Alright, so we're gonna talk to the subconscious, but this is part 2. So it's gonna be, you can take that hypnotic chair. And this is, we've done this, I think, right? When the hand talks. We've probably used it once or twice. This is part 2 because now we're going to have a conversation with the subconscious mind. So before it was just to pay attention to what the subconscious was going to do, and it meant really not much, just one finger, and we don't know what that is, right? But now it's going to turn more into a conversation, and this technique, the Swan, it's a full method of therapy by Bob Burns. Bob Burns. He's from the UK, and I'm not gonna teach you the method because, well, this is not what it's about. But I will use the technique that he uses, just for the purpose of seeing, feeling, and understanding that conversation between the conscious and the subconscious mind, right? So this is not about doing the Swan, because that will be a whole course that I don't do. But if you want to learn more about this, his name is Bob Burns. He's from the UK. He will be in Canada next year, if you want to catch him there. But I will use the technique. And for this, well, first I would like to ask you if it's okay with you for me to speak to your subconscious mind.
Okay with me.
That's okay with you, okay? And is it okay if I borrow your right hand, your right arm? Yeah. So I want to put this pillow here so that your arm is as comfortable as it can. And I want to place your arm like so. You just feel that elbow getting a little bit more tight so that your arm stays in place. And you can relax the hand as much as you can so that it feels like in the most comfortable and relaxed place, right? So that there is no tension whatsoever. And now, while I'll talk to your subconscious mind, I can place my hand here, if it's okay with you. Okay, so when I have my hand here, I will be talking to your subconscious mind. And you the observer, the conscious one, you can hear if you want, or you can think about anything else. It doesn't really matter, because I will be talking to the subconscious mind, right? The idea is for your subconscious mind to take control of the right hand, so that we can communicate with your subconscious mind via your right hand. So sometimes, depending on how well hydrated we are, how stressed we are, or the environment, or depending on a few factors, the subconscious mind might not be super thrilled. So the response might not be as big as what we want. But even if there is no movement and you feel that something is going on, you can let me know so that I know the subconscious mind is trying to express something, right? But when I have my hand here, I will be speaking to your subconscious mind. When I don't, then I will be talking to you, right? Take a deep breath in. And you can even imagine that there is 2 magnets there, just allowing that vagus nerve to really let go and communicate that information from the heart to your brain. And as you continue to breathe in and out, you allow yourself to relax, and just notice how easy it is to let go of all the tension in the body. And now I'm going to communicate with your subconscious mind. So if it's okay with you, I'd like you to take control of the right hand, and for you to talk to me in any way via an involuntary movement of any finger. And now I just wait, and I wait for a movement. There is a movement on the thumb. I'm assuming that's not you, right? That's an automatic movement, right? So that must be the subconscious mind. So now what I do is, if that movement of the thumb, if that is you communicating with me, please repeat the movement. And I watch again, and there it is. You all see that, right? You see that? So we have established a communication. The subconscious mind is open to talk to me. That doesn't mean automatically that the subconscious mind will do whatever I ask it to, because it has a purpose and it has reasons why it does everything that it does. So it's my job to convince the subconscious mind that change might be a good idea. So now, if I want to get a little bit more picky, I can say, if it's okay with you, I can assign this as a yes response and this as a no response. So if you want to say yes to me, you can move the thumb. If you want to say no to me, you can move the index finger. Fantastic. Now can you please, just to corroborate, give me a yes signal. And there it is. And now give me a no signal. And there it is. So because we have worked in the past, her subconscious mind knows me, and it's very obvious. And for some people, it might not be as obvious, but we will do this with all of you so that we can all do it and feel it. If there is at this moment any tension or stress in your mind or in your body that you want to get rid of, say yes or no if there is not. No, excellent, fantastic. So that means she's relaxed, she's okay, there is not a blockage that is not allowing her to be part of this course or anything like that, so on and so forth. Let's well, at this moment we can use this as a conversation with the subconscious mind, right? So we can ask questions about emotions, trapped emotions, about things that she might want to do. Let's say that when she came in, she said that she wants to work on I don't know, what is something that you want to work on, or that you feel might be a problem, or if you want to install a new thing, a new emotion. Being hungry is fine.
It's not something to fear, and that I don't need to eat so much.
Okay, well, that's a big task, but let's see what the subconscious mind says, right?
Yeah.
If there is a program related to your eating habits, are you willing to look into it? Thank you. The eating program, do you mind making changes if it's necessary? And that's saying it's a bit ambiguous. Saying no and yes, there is, yeah, and this is the thing about eating. The subconscious mind immediately gets like this because we have to eat. So that's why. Right, exactly. So, right, so I was kind of happy to see the no, because the subconscious mind is like, you know what? I know you, I trust you, but not that much. I have to keep eating, right? That's why I say it's a big task. It's not. Yeah. So, but this is now me having a communication with the subconscious mind, and you'll get to do that a lot easier with the legs, which is what we do when the client is there. We're basically talking to the subconscious mind. We'll just skip the whole. I talk to both the conscious and the subconscious. I place my hand here. I mean, automatically when I'm dealing with the feet, I'm just talking to the subconscious mind. I know that the client, well, the client doesn't know, but it doesn't really matter. So anyway, I want to thank you for your participation this morning. I want to thank you for being open with us. And when you're ready, you can give the control of the arm and the hand back to her conscious mind.
Oh yeah.
And I apologize. I should have told you to open your eyes and look at the hand, because you can be part of the conversation. But first, I like to tell the subconscious mind that it's between me and the subconscious mind, so that it starts to open up. After a while, if it's responding, if it's I ask the subconscious mind if it's okay to introduce the conscious mind into the conversation. If it says yes, then I tell the client you can open your eyes, you can look at the hand, and now you can talk to the hand. It's that's actually what it's called, the swan, because it looks like a swan, and the actual method involves turning the hand and talking with your subconscious mind, like if it was a swan here talking with you.
Literally, you're conversing with your subconscious
Yeah,
self.
yeah, yeah. And you can use these for yourself. Sure.
Now, where do the lines get blurred at, like, your subconscious mind moving your finger and your actual conscious mind moving?
If the person is very left brain, that might happen, but that's if you truly want to be 100% sure that, so you will feel it. It's the movement is not smooth, and it's not like it's like a jump. So
Do you choose your dominant or non-dominant hand? Does that matter?
you know what? I don't know. I always choose the right hand. But I that's a good question. I would have to ask that to Bob. I don't know. I don't think it matters, but I'm not sure. But yeah, to for your question about the conscious and the subconscious mind, it would be you would know. You would know because the movement is. So like if I tell a client, let's say we're doing magnetic hands, and have you done that before in therapy? Well, it's all talking with the subconscious mind, so it's kind of the same thing. If the client has the hands here, and I tell them, and you can relax your arms now, and they go like, okay, I know it's their conscious mind saying, oh, okay, well I can relax them, and if they go like, that's the subconscious, so I know if the person is overriding the pattern or not. With these though, it doesn't have. I've never experienced it where a client, actually it's the opposite. Their conscious mind doesn't want to move the finger because they don't want to play. I mean, they're paying good money to be like, oh, I'm just gonna move the finger because I want to. I mean, it doesn't. I don't think it
Well, I was
happens.
going to ask her, did you know, like, a second ahead of time it's going to happen, or just as it did it?
I was
first you
wondering
knew?
what the answer to the question would be.
Right, that's what happens most of the time. It's like the other person is so interested in what's gonna happen because
I didn't
You're
know.
like-
You're like, oh,
You were
okay.
waiting to hear too. Amazing.
Thank you.
no problem. Next one. I want to do this.
Do you visit with yourself often?
The problem about that is that if I am the one having the conversation with my subconscious mind will play tricks on me all the time because there is that conflict. I have predisposition